because if you have a little interest about the minimal invasive surgery and endometriosis, you have to know this name and the last name. But for the young ones, I would like to say he was in Germany, in Gießen, 15 years as a clinical chief. And after that, now he will move to Northwest Hospital in Köln, right? Dr. Tinneberg, in Köln, right?
In Frankfurt.
Yeah, sorry, in Frankfurt. Sorry about that one. Northwest Hospital. He will be head of the endometriosis and minimal invasive surgery in there with Dr. Jörg Engel. And today, he will speak about the very, very interesting subject. Most of us, we have no idea about this subject because the title is Complementary Medicine for Treatment of Endometriosis. Thank you, Dr. Tinneberg. You are here. It's a pleasure for us to listen to you. Please.
Well, thank you very much, Engin, for your absolutely kind words. And it's a great pleasure and honor for me to be part of this quite successful webinar of EEL. And perhaps I should just say a few words concerning my affiliation with endometriosis. Very early in my professional life, I got hooked on two things. One is endoscopic surgery, because my first academic teacher was Kurt Semm, who was one of the pioneers. And with him, and also with Karl Werner Schweppe, who is within the audience, it was very important for me to deal with this disease. This disease, endometriosis, is still underrepresented, and I feel sorry for the many women that are suffering by far too long. And that's why I praise everyone attending, everyone interested in finding out more about diagnosis and different treatment forms to relieve these poor women that are suffering from endometriosis. Now, you mentioned that complementary medicine is something that very few people know something about it. Let me answer that I regard it as an art to talk about something I don't know much about, because I am a surgeon, and that's why I still think, and I'm convinced, that surgery is the gold standard for treatment of severe endometriosis. However, not every patient is eligible for surgery or wants to undergo surgery, and that is why we have to see the full scope. And we had good presentations on medical treatment and surgical treatment. So when we talk about what can be done, then we have an idea of what would be the ideal treatment. And the ideal treatment should relieve pain, induce regression of endometriotic lesions, and this should also be applied to, for the severe forms. Sorry, next to me is Dr. Konstantin, and he is responsible for all the technical things, and I do not know there's some automatic appliance in here. Anyway, so what we want is, we want that everything is vanishing, and that also women with endometriosis are not only relieved from their pain and their symptoms, but that they can also become pregnant. Now, this is a wish, and so far we do not have any such form of treatment, and that's why we have to look into the big picture. And the next slide will show us just a comparison what the medical management should be. And of course, we all know that we have oral contraceptives, but they do have quite a number of side effects, including, which was found out by a study by Charles Chaperon, that it might hide an endometriosis, so that in the end, it shows up as deep infiltrating endometriosis. We have progestins and GnRH analogs as the standard treatment. Of course, we know that especially in adenomyosis, we have IUDs with levonorgestrel, and we have danazol, aromatase inhibitors, and painkillers. But also, and that's very important, we should think about complementary, sorry, there's a mistake, and alternative medicine. And this is also because the surgical management requires expertise and resources that are not always available. And nevertheless, even though an expert surgery has been performed, recurrence is quite common. And besides, not every patient wants to undergo surgery. Now, what is complementary medicine? This will be abbreviated as CAM. It is only regarded as an additional treatment to conventional treatment forms, and that includes not only surgical treatment forms, but also medical treatment forms. And we have investigated the affinity to this form of treatment, and we found that women are much more in favor of complementary medicine than men. And you can see it's female is 63 and men is 36%. What is all part of complementary medicine? It's traditional Chinese medicine, it's the traditional Indian medicine, Ayurveda, it's herbal medicine, manual therapy, and it also includes food. And with my presentation, and I hope you can see that we are sitting on the roof of our hospital, having the wonderful skyline with bright sunshine in the background of Frankfurt. Now, with my specific presentation, I am explaining certain forms. Take the next one. And we also invited two other doctors to give a short statement. Unfortunately, they couldn't be around. Now, first of all, traditional Chinese medicine has a completely different understanding of what endometriosis is. And this is why the tongue diagnosis is extremely important. And endometriosis is associated with a different understanding of blood flow. And you can see here, there is the tongue reflexology chart, and with endometriosis, the tongue might have a completely different appearance than as what we have here. The most known treatment in TCM is acupuncture, but it's not only acupuncture. Acupuncture can be in different forms, like it can be acupoint injection, or it can be electroacupuncture, it can be acupoint sticking treatment, or it can be auricular acupoint, as we can see in the graph on the bottom right side, where every association with organs is depicted. Also part of traditional Chinese medicine is herbal medicine. And herbal medicine in forms of herbal enema, which have to be, after they have been instilled into the rectum, should stay for 5 to 6 hours, which I can understand. I haven't experienced this. Could sometimes probably be a little hard and difficult. Herbal teas are a very, very important form of traditional Chinese medicine. And this would also, for instance, in case when a woman suffering from endometriosis is also experiencing infertility. So herbal teas will not only be applied to her, but also to her partner. And you can see the bottom slide here, moxibustion, where a herbal preparation is burning and the temperature has an effect. And this shows needles for acupuncture with the herbal moxibustion on top. With the traditional Indian medicine, I have to explain that again, there is a different understanding of what health or disease means. And first of all, in the traditional Indian medicine, and I do not know whether we have visitors from India, so it might be a little weird if I would explain what Ayurveda is, but Ayurveda is based on the 3 different types that persons can have. It's never that one person is only Vata or Pitta or Kapha. There is always a mixture of all these 3 doshas. However, there is one dominant dosha. And you can see Vata, which is the light one, is associated with ether and air. And Pitta, these are the very active, hyperactive, burning people. And Kapha are water and earth. It's like a heavy animal moving slowly but steadily. So when looking at these 3 doshas, the associated symptoms to these doshas is in a Vata dominated person experience endometriosis, pelvic pain, which is stinging, and they have some stiffness in their joint, but also in the abdomen. They have paresthesias that feel like if ants are running up their legs. They feel a feeling of numbness, and they experience general symptoms like fatigue and weakness. These are the patients that offer you a whole bouquet of symptoms. And of course, they suffer from dysmenorrhea, and they would describe the blood as frothy and thin, and it would be regarded in Ayurvedic terms as dry, which means that there is no mucus associated to it. And of course, they also experience spotting, which we all know from endometriosis as being a very common sensation. Now, Pitta, these fire people, they have burning sensations in the pelvis, and it feels like an inflammation. They have generally a feeling of heat, and their menses is bluish, yellowish, or blackish, and the bleeding is strong and malodorous. So they complain about a bad smell. And today we had a patient where my doctor asked me, is it a symptom or is it important? The patient complains that the discharge is smelly, and of course spotting is also part of it. Kapha is a slimy fluor. Kapha has a lot of mucus, but Kapha people feel cold. The menses is yellowish and slimy, and they may also have some spotting. So this is just to show how this is. And the treatment is multifold. And first of all, and that's quite uncomfortable, it's the Panchakarma treatment, which means that they have 1 day filled with laxatives. And the idea is, if you have Panchakarma, you empty your bowel, and with that you release all the bad substances, and then from there on, everything can be started again. In addition, there might be vaginal flushings called Uttarabasti and hip baths, which are quite comfortable. And most comfortable, of course, is the oil massages and steam baths. And you can see here, the massage is bilateral. So it is always symmetrical. Massages are symmetrical on both sides the same. And that's why 2 people are doing it. The only non-symmetrical is if you have oil dripping on your forehead, but that is being used for other things. Of course, also herbal preparations are very important in Ayurveda, and very important in Ayurveda is garlic. Garlic, which is said in the Ayurvedic understanding that it has a unique rejuvenating effect, including breasts. It is said in this quote, which I got here from Dr. Chopra from Castle, that if you regularly take garlic, the breasts will not fade. They will always be well filled and strong, and it will also help to maintain fertility for a long time, prevent STDs, and give strength and purity. But also there are preparations from curcumin, and we will hear more about curcumin later when Professor Wenzel from Vienna will talk to us, and of course many other herbs. But also they have fermented drug preparations, and these are based on Terminalia cibula and aloe vera. And also, last not least, they also use powders and tablets, and they might have a general addition of honey and of licorice. Next. The dietetics, of course, and that is another very important point in Ayurvedic medicine. It is quite well regulated what you eat. And important is that there are regular meals. These meals should be warm, and they should be light meals in the evening. Easy digestible food, some spices to enhance digestion, and the preferred spices, once again, are curcumin and ginger. And one form of food that is preferred is meat soup, a broth. And what should be avoided is heavy, cold meals. The next thing is that regular self-massages are recommended. And that can, of course, not be symmetrical massages, but you massage yourself. And it is said that by putting oil on your skin, this oil will take away toxins. And after you've oiled your skin, then you should have a shower. You have the oil on your skin, leave it there for, let's say, 10 minutes, 30 minutes, and then you go to the shower and flush away all the toxins. And of course, heat is regarded also as being something that is very important and helpful. Sport is also recommended, but it should be smooth, and it should be an endurance sport, not like sprints, but continuously sport. And it is very important not to overload, neither physically nor mentally. Now, when we come to herbal medicine, there is one very interesting aspect, and that is resveratrol. Resveratrol, which is the anti-aging substance. By the way, it is also found in red wine, preferably from Chile, because the fog coming from the Humboldt stream increases the plants to express resveratrol. It inhibits the aromatase and COX-2 expression in endometrium, decreases VEGF, which of course is quite important in order to decrease vascular neogenesis and MCP1, and it inhibits angiogenesis. Green tea polyphenols, they have a wide range of very positive activities, and these polyphenols are antioxidative and anti-angiogenic, and they enhance the apoptosis, which is very important in endometriosis, as we all know, because endometriosis means that it decreases apoptosis, and it inhibits the function of microvessels in the lesions. Puerine is also a substance from fruits. It contains isoflavonoids, and they have a weak estrogenic effect, but it has an influence of matrix metalloproteinases, ICAM1, VEGF, and tissue inhibitor of matrix metalloproteinases is increased. Last not least, once again, and that's what you know, curcumin is a unique drug, and it includes anti-inflammatory, antioxidant, anti-proliferative components, and it has become a more or less established form of treatment for arthritic people. And in our next slide, we show a video message from Professor Wenzel from Vienna, and he explains a study that he has initiated.
Dear colleagues, dear Professor Tinneberg, lieber Hans, it's a pleasure to be with you on this webinar regarding endometriosis therapy. Endometriosis, you all know, is an enigmatic disease, and we try to find multidisciplinary approaches to the therapy besides of operation and medical treatment. So we once released a special diet regarding amelioration of endometriosis related symptoms, which is a typical Mediterranean diet. So this diet is high in meat, in white meat, and low in red meat, which is high in vegetable and fruits, and which is low in animal fatty substances. Endometriosis patients should eat whole grain and non-raffinated sugar and wheat. And regarding this diet, we also try to find supplementary substances which be of beneficial effect for our patients. And you all know that magnesium and omega-3 fatty acids will help patients in reducing their pain symptoms. And there is another substance which is curcumin, which is in curcuma. And this curcumin has an anti-inflammatory and analgesic effect regarding arthritis. And we use this substance already for several months or years in endometriosis patients, but to find the real effect beside the placebo effect, you have to have a placebo-controlled prospective study, which is also double-blinded. And so we set up this study, and we are at the moment conducting this study, and half of the patients have already entered this study, which gives our patients capsules of curcumin. The trade name is flexofitol, and this was due to a hint by a colleague of mine. His name is Dr. Forgach, who uses it for a long time. But I think it needs definitely a prospective randomized study to see the real effect beside the placebo effect. So we give the patients for 3 months this flexofitol, and then we want to have the beneficial effect seen comparing placebo and the curcumin. So hopefully in 1 year I can probably tell you a little bit more about this effect. I think it's a very interesting thing because it's a non-hormonal drug, which is only a supplemental nutrition agent and not a non-steroidal antiphlogistic agent. And if it helps, I think this adds a little bit more to the armamentarium, which we have already in treating endometriosis patients. So if you want to, if you have any questions or you want to contact me, I will show you also my data, which can be found on. So I wish you all the best for the webinar. This is our data. It's the Medical University of Vienna, and we have a certified endometriosis center, and you can find us here under this email address. And again, you can see my name. All the best. Best regards from Vienna, and have a nice day. Bye-bye.
So as you can see, Brother Wenzel, it was yesterday evening because unfortunately today or tonight he was unable to attend, which would have been much more interesting. But I think he had a whole day of surgery. That's why he looked a little exhausted. Now, the next aspect is manual therapy. And we call it osteopathy, knowing that in some patients, the chronic pain is due to a lot of tension on certain muscles. And this tension will not go, not even when you perform proper surgery. The tension of the muscles will continue. And if that can be relieved, the pain will also go, because a muscle that is immensely under tension also means that it is causing pain. And I show a few slides of Dr. Kleinhans, who will also give us a brief demonstration of how to explore osteopathically. And that is the first point. Osteopathy means one has to explore the entire anatomy, and this in endometriosis mainly is the pelvis, the abdomen, and of course the back. Particular attention is paid to the connections of bones, tendons, and fascia with the internal organs. That's why you will see that they also sometimes feel through the abdominal walls to find whether there is any difference, and it requires quite some experience in order to feel these minor differences. Pain, and that's the theory of osteopathy, can be evoked by disturbance of internal organs, and the disturbance of internal organs can be caused by the malpositioning of the musculoskeletal system. And we all know that every day we sometimes have very unique positions that might then cause malpositioning of the musculoskeletal system and thereby cause pain. Now, the improvement of pain can be due to loosening tight internal bonds, and that can also cause a better internal agility. What is the approach, the osteopathic approach? First of all, it's a careful examination, and then one of the very important joints and locations is the iliosacral joint, which has been tested out. They try to find out, are there tight bonds between fascia and organs, and what are there any malfunctionings of the musculoskeletal system. What they do is, their action is loosening of blockages by proper positioning or pressing muscles, joints, and also the abdomen. And if possible, they feel that the patient should be taught how to treat themselves. And we now have a short video, and you can see Dr. Kleinhans with the patient. We had one session here showing, and what she did is, she has a patient standing in front of her, she bends down, and she wants to find out, is everything symmetrical? Because if it is not symmetrical, then something might be wrong. And then she is asking for a chair now, where she wants the patient to sit down, and she wants to see whether this asymmetry is also found when the patient is sitting. Now the patient is sitting down, and she feels once again the back, and the patient has to do the same as when standing. And in this case, when the patient was standing, there was a problem, there was an asymmetry, but when sitting, this asymmetry could not be found, and this asymmetry was regarded to be part of the anterior system. That's why the patient is now asked to lie down, and of course this is not the osteopathic practice, but this is just a chair from our conference room. And when the patient is lying, the osteopath is trying to find out the psoas muscle, and when she is pressing the psoas muscle, you can see she's pressing through the abdominal wall, and the osteopath says she is flicking her eyes, so she is showing something is wrong, and the patient says, I have a problem in my left abdomen, the left psoas muscle is painful. And therefore, she is lifting the left leg, and supporting it. And now she finds the position, and she takes her mobile phone out of her pocket, and now the left leg is put in a position where when she is pressing the psoas muscle, no more pain can be felt. And this is how she is positioned. She is always in constant contact with the patient, and now is bending it. And now the patient says, in this position, I do not have any pain. And what the osteopath is doing is say, press your thumbs, because when she is pressing her thumbs, then the other muscles will relax. And also, this is a comfortable position for the left psoas muscle. And therefore, the osteopath, while talking, she has to remain in this position for 1 to 2 minutes. And then it is as if the brain is taught how it works to relax the psoas muscle. And this is the form of treatment which she is applying. And we were all deeply impressed, because the patient who was just waiting she was jumping up when she said, is there anyone in the audience who wants this to be tried on? Because she was in severe pain, and she said miraculously afterwards that there was hardly any pain anymore. And that's why I think this is also one part of armamentarium which we have to know and which we may use. Now, when continuing, Professor Wenzel mentioned already food. And food, of course, as also in Ayurvedic medicine, is very, very important. And we can see what we need to do is we need to decrease the inflammatory effect of endometriosis. And that means we should reduce meat. Of course, red meat seems to be the worst, but also white meat. We should reduce meat, and we should increase omega-3 fatty acids, vitamin E and C, and we should increase selenium and zinc. And if we want to reduce the pain, which of course is also a very, very important symptom, we might increase the magnesium uptake, but also we should avoid cow milk product and food which contains histamines. And this is cheese, ripe cheese, it is red wine, it can be some forms of fish, salami and vinegar. And when talking about food, there might be one very important additional aspect, and that is that we know that the microbiota of our gut, which is multifold, there is more information in our gut bacteria than in the rest of our body. So, and we know that the gut bacteria have an influence on our thinking and our health. And there are quite a number of bacteria that can also increase inflammation. So if we try to find a healthy microbiota, which I cannot name right now, it is very important to find out, maybe just to change. Now, this was a short discourse on complementary medicine. And just in order to give you some help, complementary medicine is important also for conventional doctors, because there are quite a number of patients that have the wish for a therapy without side effects, a natural holistic a treatment without chemistry. Very often they are disappointed by conventional treatment. If you have an additional arrow in your box, then you are the master of the scene. Because increasingly we see that people are health consciousness and that they want to do something in addition to getting hormones or getting the offer of surgery. And it seems that also in men there is an increasing trend towards chem. These are the people with an open lifestyle and an open way of thinking. It might just be that we have this tool as an addition to the classical and conventional medicine. And when you look at this couple, you can see this helpless partner and this beautiful lady in pain and in despair, I think that any help is highly appreciated. And why not then also try CAM? However, the future will depend on other things. And we need to understand the clinical implications of oncogene mutations, also on racial and individual differences. And this is imprinted in RNAs, and we have to be more precise in our diagnosis. So complementary medicine should be an option. And I would be very happy that we have more randomized and placebo-controlled studies, including TCM and Ayurveda. And sorry, and you could see that Professor Wenzel in Vienna has taken this approach and is performing the randomized placebo-controlled study with curcumin. And this is my last slide, and I thank you very much. Maybe we can have the nice background of Frankfurt skyline once again, and I'm happy and open for any question that you may ask. Thank you very much for your attention.
Thank you, Dr. Tinneberg. It was so fantastic. Thank you so much. Actually, I learned a lot of things from your lecture. Do you have any questions from the audience? Any comment? Let me start first. A few questions, Dr. Tinneberg. In one of your last slides, you said no side effects for the complementary medicine. How can we say we have no side effects from these treatments, especially for the new drugs like curcumin, something like that? Do we sure or not?
Yeah, well, I think it is a misunderstanding. It is that the patients that you know, we asked patients that underwent or they opted for complementary medicine. They were asking for complementary medicine, and we asked them, why do you want complementary medicine? And they said, because we do not want to have side effects. I absolutely agree with you that every specific substance that we take, whether it is herbal or whether it is food, even food, you know, if we are single based in what we do, there can be side effects associated to it. But the perception of patients is that the complementary medicine in comparison to conventional medicine is free from side effects, which of course is not correct. But of course the side effects are different, and most of all, of course, patients are afraid of surgery, but also patients are also afraid of hormonal treatment forms.
And the second, do we have any questions from the audience?
Yes, I have a question.
Please, Katerina?
Yes.
Hi.
Hi, how are you? Fine. Thank you for the lecture, Professor Tinneberg. I have one question, as for the first two at least. And the first is there any differences between I can open also the video, between the type of endometriosis? That means if there is different therapies that we can have for deep endometriosis or for viral endometriosis, because deep endometriosis of the rectum has different symptoms. This is the first one. And then the second is, many of my patients with deep endometriosis had a good pain relief by diet which are gluten-free and lactose-free. So this diet are often similar to what you show in the other type of diet that you, I don't know if you have the same experience.
Well, my experience with complementary medicine is quite multifold. And I must admit that there is no standard treatment for any form of endometriosis, and it really requires a person that has a good approach to complementary and alternative medicine. And to answer your first question, there is definitely no specific form of treatment for instance, rectal endometriosis. And I should tell you of one patient who had a very bad rectal endometriosis, and she had severe problems, and she wanted to escape surgery. So she underwent a traditional Chinese medicine, and she was coping quite well. She still had pain, but she could continue with her daily life under herbal teas and acupuncture. But after 7 years of mild suffering and symptoms, this was over, and she was happy that we performed a segmental resection in her rectal endometriosis. So this is definitely not the answer to the established forms of treatment. But I was quite impressed with the extent of this rectal endometriosis, how long she was surviving with with this traditional Chinese medicine. And the approach and of diagnosis differs from Chinese to Indian to any other form. When you look at the symptoms can also be multifold. As you know, the pain can be radiating into the leg or into the labia or into other areas. So from that on, it requires a very experienced person to deal with the diagnosis, and therefore also with the treatment form of complementary medicine.
Do we have another question? Actually, we have one question from Turkey, Dr. Tinneberg.
Yes, please.
Dr. Pınar Bahat, she's saying, thank you for a nice presentation. She's saying, is there any complementary medicine you suggest in your practice after the endometriosis surgery? Do you recommend anything after the surgery as an ordinary?
Well, we regularly recommend a rehabilitation. In any case of a woman with chronic pain due to endometriosis, and in our center here, we have mainly deep infiltrating endometriosis. And these patients are all referred to a rehabilitation center. Now, what is a rehabilitation center? What they do is physiotherapy, osteopathy, diet treatment, and psychotherapy, and sometimes this will also be referred to traditional Chinese medicine or Ayurveda. The problem with TCM and Ayurveda is that most patients have to pay it themselves, and a lot of patients probably are not able to afford this. And especially with Ayurvedic medicine, it takes quite some time, because you should take 3 to 4 weeks, and this is in a working situation is quite difficult to do. But it is quite efficient. And the next point, for instance, with Ayurvedic medicine is it is very difficult to transform, for instance, the advices for their meals into daily life, because they advocate 5 meals per day.
Actually, we have one question from Valeria. I don't know if she is doctor or patient, but she says she has chronic rectal pain, and the proctologist see her. There is no problem, only maybe she has weak pelvic floor, and gynecologist says maybe this is related from the endometriosis, I mean chronic rectal pain. And the last year, she had a lesions, ultrasacral ligament remove on the surgery. I mean the endometriosis surgery, ultrasacral ligament surgery. And she's asking, could osteopathy any relief about this condition? She has Visan now, Visan therapy now. What do you think about this patient? The problem is chronic rectal pain.
Yeah.
Without known any pathology.
Yeah. Well, of course, a weak pelvic floor can, of course, cause pain, intussusception, and other things. But once endometriosis had been established, I would really recommend to have an expert ultrasound. So Katerina is here, maybe Valeria is nearby, so she should consult Professor Exacustos in Rome. Or have the gynecologist do a rectal vaginal exam, because if the pain is very low, then of course this is quite helpful in diagnosing whether there are any nodules. And you can also have triggering points when doing this examination, which is not very nice, neither for patient, not for the doctor. You can feel whether there is something which will trigger the pain. And I'm not surprised at all, Valeria, that the proctologist didn't see anything, because that's the common perception and the common experience that we have with proctologists. They have great problems in visualizing endometriotic implants, because the mucosa that covers the endometriotic implant is not disturbed. It is quite normal. So just to answer the question, osteopathy can of course bring relief, because there will be tension on the pelvic floor muscles, but I could not say what form of osteopathic treatment would be best for you. There is one form where one hand has to enter the vagina to compress these muscles, but that is what you have to find out by an osteopath.
Another question from audience? Actually, in your one of the beginning slides, you mentioned what is the aim of the endometriosis therapy. But for the complementary medicine, only we just relief of the pain, not the other ones. Am I right?
More or less, because we can also see, and that is interesting, that for instance with curcumin, the point is, since the angiogenic effect is reduced, which also applies to some other herbal medicine, it can be that the implant shrinks. This is similar to what we know from Visan, for instance. Visan also allows shrinkage and reduction of edema, but once you stop this form of treatment, then the implant will continue. To the best of my knowledge, there is no treatment whatsoever that will make endometriotic implants disappear. So that's why I'm absolutely convinced that surgery still is very important, and that's why we are also doing this form of treatment. However, we need to know all these other forms of treatment to have a complete armamentarium to help our patients, and the patients have to decide themselves what form of treatment they prefer.
Okay, Valeria, yes, Dr. Tinneberg can do it, your examination in the endometriosis center. You live near Frankfurt, yes, he can do it. As you know, he's the master about this subject. There will be no problem. Another question from the Turkey. Nilüfer says, you suggest avoid of heavy cold meals, right?
Yeah.
What is the mechanism of this recommendation?
Now you're asking me something. In Ayurvedic medicine, everything that is cold is bad. And if you drink something cold, you will slow down the digestion. And in Ayurvedic medicine, digestion has to be taken real care of, and that's why they have addition of certain spices, and they have light warm meals, so everything is lightly digested. If you drink cold milk, then you have two bad factors. One is you have a cow milk product, and the second is it is cold. So this is really bad for endometriosis. But what is the effect on endometriosis in a biochemical way? I cannot tell.
Okay, another question from Maya, right? And the question: supplements, serapeptidase, nattokinase, and drumbrokinase. Do you know these ones, Dr. Tinneberg?
No, I do not know, but these are enzymes, and
yes,
enzymes may have a very important role. What I know from enzymes, especially enzymes that can destroy RNA, information that is released by cells that have a problem, and these enzymes can cause that symptoms are relieved. And some enzymes can also decrease pain. So I do not know these three specific enzymes, but in general, enzymes can be quite helpful for reducing inflammation.
My last question about this subject. For the big picture, could you say just briefly, what is the role of the complementary medicine in your endometriosis practice? Which patients is suitable for this practice? Which ones? Just briefly.
Well, we have quite a number of patients that have had every form of treatment without great success. They are disappointed from whatever has been done, and these are the patients that I recommend to go for complementary medicine, and that's why we explain what forms of complementary medicine is available. Osteopathy is for those where we cannot see any correlation of an implant to pain, and that's why we feel, especially when we test the trigger points, that the too strong tension on the muscle could cause pain. And in general, we have with our vowed to explain also complementary medicine, so that this is not only restricted to conventional medicine, including surgery and hormones.
Okay, another question. What is your favorite complementary treatment, Dr. Tinneberg? Your favorite one?
My favorite, that's difficult to say because everything is individual. But basically, I prefer traditional Chinese medicine and Ayurveda. But as I just explained before, osteopathy is a new approach, and we have seen many patients that benefit a lot in terms of pain reduction from osteopathy.
Another question from Constantine. These complementary medicine therapies are useful only just for after the surgery, or to get the successful surgery, do we have to use before the surgery, this one? What do you think?
The surgery is not being influenced by any medical or complementary form of pre-treatment. That's my personal impression. But I think that some patients, they want to avoid surgery, and why not allow them to have a test of complementary medicine? Secondly, when they had undergone radical surgery and they want to do something that inhibits soon recurrence of endometriosis, why not have them try complementary medicine? Because, for instance, our hormones, they have a lot of side effects, and complementary medicine has less side effects.
Another question from Maya, and there is about soya in diet.
Yeah.
Should we advise avoid this one or not?
Well, soya, if you replace milk product, cow milk products by soya, it is good. But on the other hand, if you have a lot of soy products, soybeans, that has quite some phytoestrogens, and these phytoestrogens act on tissue similar to normal estrogens, so they can also push endometriosis, because, as you know, endometriosis is estrogen dependent.
Thank you. Sarah, I didn't understand your question. Could you write a little bit clearly? Do you want to use the diagnosis instead of the complementary medicine, or vice versa? I don't understand. And the last question, actually last comment from you, we have a beginner and young colleague in here. That's why, could you say something about, if I am 30s, I would like to interest in endometriosis, but what can I do? What is my algorithm to start endometriosis? How can we learn endometriosis in a deeply? If I am 30s, should I start from the surgery and just look at the patients and just read it? What is the best way in your experience?
Well, this is a very good but also very difficult to answer question. My feeling is, first of all, you have to know the pathophysiology of endometriosis, which is very difficult. And then you should start with a very good diagnosis. To learn how to diagnose endometriosis takes quite some time. And once you know how to form a proper diagnosis, and this is not only examining patients, but also talking to patients, understanding the patients. These patients are chronically ill, and they need someone to listen and not to say, okay, I know. And then you go to treatment. And of course, it is like a balance. You have to balance medical treatment and complementary treatment and surgical treatment. And you have to find the right and best way how to balance both forms of treatments.
Thank you so much, actually. It was so interesting and good lecture for us. Thank you, Dr. Tinneberg, for your contribution.
My pleasure.
Next month, there will be no webinar. We will be on a break on August, and the next webinar will be in September, 15th of September. Our speaker will be Dr. Attila Bokor, which is our executive board member. He will speak about the natural orifice specimen extraction for deep endometriosis surgery. I mean, from now 2 months later. Harald, would you like to say something about?
The last words. Yes, Hans, thank you very much for your very nice and interesting lecture. I think it was really good to learn all these new details. We had a lot of questions in our chat. Thanks to everybody for the good questions and the discussion. And I'm sure that we still have to learn a lot about complementary medicine. And we also use it, and sometimes I'm not sure when and how, but I think it's a very good additional tool. And it seems that the patients are very interested in this kind of treatment, so we have to go ahead in finding out more details about it. Thank you, Engin. Yeah. Thank you, Hans. Good night to everybody.
Good night. Good night. Okay. Bye-bye. Bye-bye.
Thank you so much. Thank you for the contribution. Thank you for joining us. Thank you so much. Good night.
Bye-bye.
Bye-bye.